The cat turns. Once, twice, 3 times. It is a soft, rhythmic ritual that ends in a deep exhale and a curled ball of fur. For most owners, watching a cat pat down its bedding is nothing more than a charming, instinctive habit. They are just securing a quiet corner, preparing for a long, undisturbed nap. But the rhythm matters. When that circle becomes a loop persistent, mechanical, and detached from the act of sleeping, the meaning changes entirely. The behavior stops being a ritual and starts being a signal. If the pacing continues long after the cat should have settled, you are no longer looking at a nap. You are looking at a warning. Veterinary experts categorize this specific, repetitive motion as a clinical symptom that demands immediate attention. It is the boundary between normal animal behavior and a medical emergency. While many owners dismiss the movement as a simple quirk of personality, the persistence of the action often hides a deeper, systemic issue. Understanding this shift is the first step in recognizing when your cat needs help. The transition from cozy habit to urgent medical concern happens in the repetition. When the circle does not close, the alarm must sound. Observe the path. If your cat circles with a shifting, erratic gait, constantly changing direction, the cause is often environmental stress or high-level anxiety. It is a restless search for comfort that fluctuates. But watch for the bias. If the cat fixates on a single, unwavering direction, always turning left or always turning right, the problem is likely biological. This directional bias is a red flag for neurological failure or an inner ear disorder. The internal gyroscope has broken. Inside the ear, delicate structures responsible for balance are failing. Infections, mites, or internal polyps act as physical blockages, sending false signals to the brain that the ground is shifting. The cat reacts by attempting to correct its position, resulting in the perpetual, one-sided loop. This leads directly to idiopathic vestibular disease. The head tilts at a sharp, unnatural angle as the cat tries to find the horizon. Eyes dart back and forth in rapid, involuntary movements. The world is spinning for the cat, even when it stands on level floor. It is a physical struggle against an invisible tilt, and every turn is a desperate attempt to regain a center that no longer exists. Beyond the inner ear, the threats turn lethal. A mass growing within the skull exerts pressure on neural pathways, stripping away the cat's ability to coordinate basic movement. The brain tries to process these distorted signals, and the circling becomes a blind, mechanical reaction to encroaching neurological collapse. Trauma from past injuries can leave similar, hidden scars, manifesting as sudden seizures or intermittent loss of motor control. The danger is not always found in the head alone. Systemic failure acts as a silent executioner. Untreated hypertension spikes, threatening to burst delicate vessels and trigger strokes that leave the cat disoriented and pacing in a frantic, inescapable loop. Hypoglycemia, the drop in blood sugar common in feline diabetes, forces the body into a state of metabolic crisis. The cat circles not to secure territory, but because its fuel is failing. Even the chronic, grinding agony of arthritis can force a cat to pace, shifting weight constantly to find a position that does not burn with joint pain. These are not behavioral quirks. They are alarms ringing from the internal organs. Every rotation is a symptom of a body fighting to remain functional as the core systems begin to fail one by one. When the circling becomes unceasing, the window for intervention narrows to hours, not days. The veterinarian arrives not to watch, but to isolate the damage. The exam starts with the basics, testing the cat's balance and neural reflexes. The doctor watches the eyes for nystagmus, gauging the involuntary flickers that signal brainstem involvement. They check the paw placement reflex, pushing the cat to step over its own feet to see if the brain recognizes the limb's position in space. If the cat missteps or drags its toes, the neurological pathway is compromised. This is a critical diagnostic crossroads. The veterinarian moves immediately to stabilize the patient, ordering blood panels to rule out metabolic spikes or organ failure. But for deeper localized trauma, the standard exam hits a wall. The doctor prepares the machine for advanced imaging. An MRI or CT scan is the final, necessary step to look past the skull. It is a race to see the internal map to identify the exact point of pressure or damage before the function is lost entirely. Every second spent in the scanner is a move against the clock, turning the mystery of the circling into a target for urgent medical action. Once the diagnosis is confirmed, the path to stabilization begins. For bacterial infections, the treatment is direct, using targeted antibiotics to clear the inflammation that disrupted the inner ear. Systemic issues like diabetes require a shift in daily routine, with precise medication and dietary adjustments that bring blood sugar back into balance. When the cause is cognitive decline, the focus moves to environmental modification. The veterinarian recommends keeping furniture in fixed positions and maintaining consistent daily schedules to reduce confusion. Small nightlights in darkened hallways help the cat navigate during the hours when their internal clock falters. These changes minimize the disorientation that triggers the pacing, allowing the cat to reclaim its sense of security. The goal is to remove the obstacles that force the cat to circle in frustration. Every adjustment is a deliberate step toward restoring normalcy. Professional veterinary care turns a frightening symptom into a manageable condition. By staying observant and acting the moment the behavior becomes persistent, you ensure the cat receives the support needed to maintain comfort. Recovery is not always a return to the past, but it is a consistent improvement in the present. Proactive care remains the most effective tool in preserving the health and quality of life for your companion.